Hello again in study 101.1. Now we're going to do the Amstar grading checklist. Okay, so we will begin with study number 4. Amstar consists of 16 questions. We can check them here at amstar.ca and go into the tab of checklist. And we'll see what we're going to do. First question is, did the research questions and inclusion criteria for the review include components of PICO? What's PICO? P stands for population, I for intervention, C for comparator group, and O for outcome. So you will check if those four are present, then yes. If one is not present, one of them is not present, then you should type no. So we see the population. I already done that. The population was specified here. This is the outcome they seek. Okay, we have here comparator group. Yes, we have a comparator group which was randomization allocated blah blah for PCI and for medical treatment. So we have comparator group. What about the intervention? Okay, we have PCI, which is the intervention, and the population. We have, of course, the population. Patients with median time for randomization, blah blah blah. What do we have here? Okay, we may see another thing in stable patients with AMI, and also we can see something here. Yes, it was here. No, so it was mentioned, so we will say yes. Number 2, did the report of the review contain an explicit statement that the review methods were established prior to blah blah blah? So, the authors state that they had a written protocol or guide that included all the following. So, if they had a protocol, just say partial yes, okay? So we will check if they have a protocol. It should be written at the end. We may search for it. Protocol. No, this is about the intervention. So they have no protocol. Then we will search for those things. Did they have a question? Yes. A search strategy? Yes, it was written at the end here. Then inclusion exclusion criteria? Yes, it was pretty cool here. And risk of bias assessment? Yes, the validity assessment was done. So that's for if we write yes, so we have to check all those for the partial yes, and we should have also another specification here. So did they have the protocol should be registered? So they have no protocol, so we'll write partial yes. Number 3. I like it to be capital. Okay, number 3. What do we have here? Did the review authors explain their selection of the study design for inclusion in the review? Yes, they said that it was only RCT. So we write yes. Next. Did the review authors use a comprehensive literature search strategy? So they searched at least 2 databases. They provided the keyword at the end of the study. They justified the publication restriction. I don't know. Let's see. Search keywords and available in the appendix. Proceeding. Blah blah blah. No, there's nothing here. No, it won't be here. Let's check the end. Let's check the implications. No. I want the limitations. Yes. Okay, let's see. No. Let's check the inclusion-exclusion criteria. Nothing here. So, they have no restrictions. For yes, should also have. Search the reference list bibliographies of the included studies? I don't think so. Search it trial study registries? No. Included consultant contact experts in the field? No. I'll say partial yes. You just have to check. I checked this before, so I say no. I've already read this paper for 4 or 5 times, so I nearly memorized it. So, did the review authors perform study selection in duplicate? Yes, they performed that selection in duplicate, but about the extraction, they didn't say anything about it, so we will say no. Number 7. Did the review authors provide a list of excluded studies and justify the exclusions? Okay, let's see this. Not all the studies done this, but here I saw it. I'm pretty sure I saw it. Again, we identified 20 eligible citations which were assessed for compliance to the inclusion and exclusion criteria. We further excluded 10 studies. 6 because blah 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 and so on. So yes, they provided a list. It's not necessary to be in a table, but it's just okay if it's just, said in a sentence or so. So I'll say yes. Provided a list. Okay, and justified the exclusion. Yes, they said the studies which were excluded and they said why they were excluded. So I'll say yes, not partially yes. 8. Did the review authors describe the included study in adequate details? Okay, let's see. Okay. Baseline characteristics. Number of patients. Clinical scenario. Okay, and the follow-up and the primary outcome. This is important. So, they said the population, the interventions, yes, they said it. The comparators, no. Yes, they said the comparators here in this table. The medications, they said it. The outcomes, they said it. The interventions here, the medications here. And the research designs, they were all RCTs, so it's okay. So, did they describe the population in detail? No, they didn't provide so much detail. The time frame for the follow-up, yes. They said it, I think. Follow-up, yeah, midterm follow-up. Study setting, no. The comparator in detail, no. Not really. So, I'll say partially yes. Of course, I may have made a mistake, but you just have to check on me. So, the risk of bias. They only included RCTs. So, for RCTs, for partial yes, they had the unconcealed allocation and lack of blinding of patient assessors and blah 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 blah. And for yes, allocation sequence, they were not truly random, and selection of the reported results from among multiple measurements or analyses of a specified outcome. So we will see that. Okay. We separately estimated the risk of selection, performance, detection, attrition bias, and allocation concealment. So I'll say yes. But let me check for the table. This is a good one. Okay. Nothing else. So I'll say partially yes. They didn't provide all the data for it. Okay. Just when you see the Cochrane collaboration studies, you'll see a table full of many, each RCT, and each RCT got how much or how many was its outcome in the assessment for the Cochrane collaboration. It's written in a table, so on. So did the review authors report on the source of funding? Okay, let's see. Funding. I don't think it's important. I may search for fund. So don't write funding, just write fund or so on, so you can, the study may be written in this way. We were funded, or the study was funded by, not the funding of the study and so on. So write fund and see. So they didn't say if it was funded by whom. 11. If meta-analysis was performed, did the review author blah blah blah? For yes, the author justified combining data in the meta-analysis, and okay, they use an appropriate weight and technique to combine results. Okay, so we'll check if they made the heterogeneity test and investigated the causes of the heterogeneity. This is important. So they have here heterogeneity, and about the reasons for heterogeneity, we just have to check in the limitations to see it. Yes, here. No, they didn't say anything about the causes of the heterogeneity. So, I'll say no. 12. If meta-analysis was performed, okay. Did the review authors assess the potential impact of ROB in the individual studies on the result of meta-analysis? Okay. Included only low risk of bias RCTs, or if the pooled estimate was based on RCTs at variable ROB, the authors performed analysis to investigate possible impact of ROB on summary estimate of effects. Yes, they did that. Okay, next. 13. Did the review authors account for ROB in individual studies when interpreting, discussing the results of the review? Yes. Include only low risk of bias, so on. So, yes. This is very near to the previous question. I think those two are sort linked together. If one is yes, then the other is yes. If one is no, then the other is no. I think so. So, 14. Did the review authors provide a satisfactory explanation for, and I did 13. Yeah. 14. Provide a satisfactory explanation for and discussion for heterogeneity